Okay, we're good. Day 2, here we go. So I just want to thank everybody that's listening in today, and again, another shout out to the team that preceded me as I was incoming governor, Dr. Alexander-Scott, and along with Commissioner Infante-Green is here today with us, and Commerce Secretary Pryor. So thank you for joining me. Little birdie told me that it's Dan Schwartz's birthday today, and I just want to thank the vets for all this efforts that they've given to keep us set up and give us a new setup today. But I think that what we're going to do is, each of us will give a presentation, we'll sit down and we'll answer your questions. So if you can accommodate us that way, I think that we can make this nice and smooth and efficient. So yesterday was my first day in office. But we didn't spend too much time behind the desk. I spent the day out in the community with municipal leaders, faith leaders, small business owners, talking about why we need to build engagement and create a full state response to help us get shots in the arms and overcome vaccine hesitancy. We visited the Providence Vaccine Clinic at the John Hope Settlement House. We saw a great example of how we can engage communities in our vaccine rollout. Our team, the community, knows and trusts getting people in the door and putting shots in the arms. We met with faith leaders at a Providence church that's been an important pillar of this community on Broad Street to help keep its congregation and its neighbors connected. These local leaders know how to do the vital outreach to bring residents in the door and, again, get shots in the arms. We checked in with small businesses on Broad Street to discuss Rhode Island's economic recovery, and that particular business was not aware of the PPP loan. So we're going to send somebody down to make sure that every business in the state of Rhode Island takes advantage of that small business loan before the end of the month. Businesses, as Secretary Pryor has told you, that have 20 or less employees have priority for another 7 days. And we want to make sure that those businesses get their applications in so Rhode Island's economy can benefit from that along with the small businesses. In the afternoon, we made it clear that combating vaccine hesitancy is a top priority. I was joined by municipal leaders and members of the state COVID response team to sign an executive order that directs the Department of Health to engage communities in the state's vaccination efforts and update Rhode Island's outreach and communications plan on reducing vaccine hesitancy. I ended the day in North Providence touring another community vaccinations clinic. I thank Mayor Lombardi. I was there with Senate President Dominic Ruggiero, which is in his district, and saying that thank you to all the staff and volunteers who are mobilizing in remarkable ways to keep their fellow community members safe. And I also add that earlier this week, my wife Susan got online and made a reservation, an appointment to get a vaccination at the Dunk Center. We encourage everybody to use those resources just as my family did, and Sue and I now have our first shot, and our second shot I think is scheduled for March 23rd or something like that, so that's good. Now, we know the fastest way out of this pandemic is through getting shots in the arms quickly and simply. Rhode Island is making headway toward that goal. 289,000 Rhode Islanders have been vaccinated to date. We're putting 8,000 shots in arms each day. In the last 2 weeks alone, we've seen incredible progress on the speed of our vaccination distribution. Just over the last 2 weeks, the New York Times ranked Rhode Island 50th in the nation, and with the extraordinary work of our National Guard and the entire team and our local municipal leaders, we're now ranked number 7. And we're just going to keep on going up the charts. Over the next few weeks, our team will continue to build on this momentum. On education. Earlier this week, President Biden set a goal for the country to get its teachers vaccinated. It's nice to know that he agrees with the state of Rhode Island and the new governor that his directive was heard loud and clear, and we're going to adopt that as our goal to get a shot in the arm of all teachers and related staff with a high goal of before the end of the month. Rhode Island is working on a plan to get shots in the arm of all teachers and school staff. We'll have more to say on that next week. We know Rhode Island is just one of the few states in the nation that is absent a plan to get teachers and school staff vaccinated, and this is the time to do it. Right now, through the work that's been going on over the last few weeks, more than 80% of Rhode Islanders aged 75 and over are vaccinated, and more than 60% of Rhode Islanders aged 65 to 74 are vaccinated. And there's 46,000 more appointments that have been scheduled between now and March 13th. In just a moment, Secretary Pryor will provide some updates on changes in the business restrictions. I'll let him outline the details, but I'll say once again that our goal is to identify areas where we can provide businesses with incremental flexibility that will not impact our positivity rate or our hospitalization rates. That being said, now is the time to double down on the following guidelines, protocols: wearing masks and being as diligent as possible. We don't want this variant to get us off track. If we can keep Rhode Island in a stable place, we can continue to build on this incremental flexibility. Right now, we're looking at daylight savings time, put a little sunlight, more sunlight in the state of Rhode Island around March 14th as our next benchmark for moving forward on flexibility on our businesses. I'll wrap up by saying that as our teams move forward, this will be our approach: getting vaccines out of inventory and into arms, increasing capacity so when vaccine supplies increases, we're ready to go, supporting our communities as we merge municipal vaccine sites into strategic regional sites, opening additional state sites, and engaging our cities and towns on a plan to vaccinate teachers and school staff. I want Rhode Islanders to know that our team is working every day to get shots in the arms, teachers and students back in the classrooms, and businesses back to business. Together, we will beat COVID-19, who is our enemy, and we're going to beat our enemy. Now I'll turn over to Dr. Nicole Alexander-Scott to walk us through the numbers. Doctor?
Thank you, Governor. Good afternoon, everyone. I do want to congratulate the Governor publicly. We look forward to continuing the important work that we have to do for Rhode Islanders. So as you can see on the screen, our data overview shows that our COVID-19 situation in Rhode Island has remained stable. We have 375 new cases to report today of 19,550 tests for a percent positivity of 1.9%. Our overall weekly percent positive rate increased slightly from 2% to 2.1%, and that's something we are obviously keeping an eye on. We know that some specific communities also did see increases, which drove our overall statewide increase. We also announced earlier this week that 4 additional cases were identified with the new variant. So putting those pictures together are items that we want to continue to monitor closely and cautiously. The good news is that our hospitalization data continue to improve. We have 148 people currently hospitalized. Our number of total new weekly hospital admissions is 125, down from 176 the previous week. Overall, our hospitalizations are down by about 73% from their peak in November and December. Although we very sadly have 5 new COVID-19 associated fatalities to report today, our overall fatality data continues to hold steady. Our COVID-19 associated fatalities are down 84% from their peak in December. That's important, knowing that saving each life is what this is about. And as I've shared in previous weeks, our decreases are even more significant in the groups where we focused our vaccination efforts early on in phase 1. Those include healthcare workers, residents in nursing homes, and other congregate settings. As we know, we have since expanded our vaccination efforts and are continuing to make important progress. To date, we have administered almost 290,000 doses of vaccine, which is roughly 25% of Rhode Islanders 16 and older that have received at least one dose of the vaccine. That's important. That's a number we want to continue to grow. We are administering almost 8,000 doses a day in Rhode Island when you look at a 7-day average compared to what we were doing in earlier months. That administration rate is up by 210%. As a reminder, we have 3 public channels for accessing vaccination: our retail pharmacies, and then our regional or municipal-run clinics, and our state-run sites at the Dunk and at Sockanosset Crossroads in Cranston. As I announced last week, we will open new sites in Middletown and Woonsocket shortly. The Middletown site will open first, either next week or the following week. For our state-run vaccination sites, we are currently registering people who are 65 years of age and older. That's true for eligibility across all of our 3 public channels. From that eligibility standpoint, we are working as hard as we can to move as quickly as we can to our next 2 groups, which are simultaneously people who are 60 to 64 and people 16 to 64 who have underlying health conditions. As the governor shared, we are planning to get educators vaccinated, and we're doing this while continuing to stay on schedule with our next groups that have been mentioned. We set out mid-March as our target for those groups, and we're committed to meeting that target while continuing our focus with the educators. We're getting a little help with the immediate addition of doses of the Janssen vaccine, which is also called the Johnson & Johnson vaccine. It was deemed safe and very effective by the FDA, and our Rhode Island COVID-19 vaccine subcommittee recommended yesterday that Rhode Island go ahead and begin administering this vaccine. We received 9,100 doses on Tuesday night and are distributing them now and working on getting them into our existing public channels for administration. That means our state-run sites, our local and municipal sites, as well as clinics in our high-density communities, hospitals, community health centers, and other places. We will also eventually be using some of this vaccine for homebound Rhode Islanders and other targeted communities that would benefit from a one-time dose. Of note, the Johnson & Johnson vaccine performed very well in clinical trials against the new variants of COVID-19, which is extremely valuable for us. And it was 100% effective in clinical trials in preventing hospitalizations and keeping people alive, preventing deaths. That's also tremendously important news and directly aligns with a big part of our focus. The last update on our vaccination campaign that I want to provide is on the work happening in our communities that are hardest hit, focused on getting people vaccinated. Central Falls is the good news. We've had some amazing success there. Roughly 34% of adults in Central Falls have received at least one dose, and 93% of Central Falls adults 65 and older have received at least one dose. Since we started vaccinating in Central Falls, we have seen a 63% decrease in cases. However, we know that we have much more work to do in our other communities that have similarly elevated case rates and elevated rates of hospitalizations. That means Pawtucket, and that means specific zip codes in Providence. The good news is we have the model of what works. We know what works because we saw it work in Central Falls. It's about being in the community, engaging people, being creative on how we are accessing them, whether it's going door to door in housing authorities or food pantries, or engaging with community organizations and churches, and using a number of creative strategies while partnering with trusted community leaders so that we can bring down barriers to vaccination. We have that model, and we are determined to be able to apply it in the communities that need it the most. Those are the updates I have on the vaccination campaign. And as we are continuing to say, we have the 3 tools that are critical to get us through the final phase of this. Vaccination is one of them. It's also testing and treatment. So continue to please access the tremendous capacity we have for testing, treatment, and vaccinations as we continue to roll that out. Before opening things up for questions, I want to finish with adding in information about testing as well as treatment. On testing, as a reminder, we have a testing program for businesses. You can get free Binax Now rapid test kits to do regular testing of employees within your businesses. We have also opened a call center to support businesses taking part in this program, and this is a great way to meet people where they are and contribute to reducing the spread of COVID-19 in the workplace, while minimizing disruptions to productivity and staffing in the workplace. To learn more, you can go to health.ri.gov and look at the announcement we have posted there on our homepage about testing, supporting businesses. Also with testing, we are doing a new round of serology testing. Serology testing looks for proteins in the blood called antibodies, which are produced by the body in response to the presence of a virus. Serology testing tells us whether someone was previously exposed to COVID-19. We sent out letters to 10,000 randomly selected households about getting tested. Testing is available now through March 12th. We had done this successfully earlier on in the pandemic response, and we're excited about the opportunity to see what we can learn now. If you get a letter, we're asking you to please consider taking part in this study. This kind of information that we can learn from this testing is incredibly important for the planning we're doing around COVID-19 in Rhode Island now and into the future. Vaccinations, testing, and treatment. A final reminder about treatment. We have very effective COVID-19 treatment for older adults, 65 years of age and older, and for people with underlying conditions regardless of your age. I've talked over the last few weeks about Rhode Island being a national leader in reducing hospitalizations and reducing fatalities. A lot of that is because of our approach to the vaccination campaign, but we've also said that our leadership with testing and our work with treatment have also played an important role. Please make sure that you have the information that you need if you were to test positive and have symptoms and you or a loved one are 65 years of age and older, or you are an adult with some underlying illness. To learn more, visit covid.ri.gov/treatment. Treatment is available even if you don't have a doctor. We want everyone to be able to access the resources that we have available and help us get through to that great summer in Rhode Island that we're looking forward to. With that, I'm going to hand it over to Commissioner Infante-Green.
Hi, everyone. So good afternoon. I am so incredibly grateful to be here with our new governor, Dan McKee, and my colleagues, Dr. Alexander-Scott and Secretary Pryor. I want to take a moment to acknowledge all the work that has been done to get us to where we are today, particularly our superintendents, school leaders, our teachers, our families, and yes, our students. It's been an incredibly long year for all of us. I know that you guys feel it too. But we have seen our schools apply creativity, flexibility every single day in the classrooms, both virtually and in person, and we are truly grateful. So here we are. We have been able to return students to school in the fall because of the diligent planning of our schools, our LEA leaders, and we have been able to keep our classrooms open because of their dedication to providing educational opportunities for our students, no matter what the obstacles are. Thank you to our teachers, our teaching assistants, our bus drivers, our monitors, our school principals, superintendents, and everyone that continues to push forward for our students. We have put necessary mitigations plans in place to ensure our schools are safe and supportive environments. Our teachers and school staffs are always and have always been a top priority, arriving every day despite sometimes incredible challenges to ensure that not one moment is lost this school year. So every time a resource becomes available, we put it in action in our schools. It's always been about mitigation, mitigation, mitigation. We provided HEPA filters in all the classrooms in the state as soon as they became available. We piloted and then expanded successful school-based testing opportunities in our buildings to provide surveillance testing. And we're way on track for this virus not to spread. We know that the school buildings, we've said it time and time again, is not where the spread is. However, even though we're at 1% and under, even in communities where it is higher, the positivity rate, we understand the importance of putting our educators as a priority as we move forward. I have to thank our governor because before yesterday, he's been talking about our educators being a priority. I can't tell you how we sighed. It was a breath of relief for all of us because this has been an incredibly long year, incredibly long. So now that the vaccines and additional doses are going to be available, we can continue to protect the classroom spaces as we have done. This is another mitigation, another layer of protection. So we would continue to advocate, and we have to have access to the vaccine, and this is the moment. The governor has given us this moment, and the moment is here, and we're going to take advantage of it. And Governor, you're right, the president has heard you and is following suit. So we feel very grateful. While our schools will continue to feel the same for a little bit, there's a light at the end of the tunnel. We can all see it, we can feel it, and we're almost there. So I want to thank all of you, every single one of you, for all the support. But I want to thank the governor for really pushing this agenda. I can't tell you what it means to our community. And I look forward to continuing to partner with our new governor, because it's not just what's happened in the classrooms, it's what we know our kids have lost. What we know is going to lie ahead of us is a lot of hard work. And we're here to do it because we're going to make the education system in Rhode Island one of the top in the nation. Our teachers have demonstrated that we can do it, and we're going to do it. So I want to thank you all. Quiero decirles a las familias en español que nosotros estamos trabajando fuertemente para que le den la vacuna a los maestros, a los educadores que están con nuestros niños, para poder seguir llegando hacia adelante y poder continuando proveer instrucción en persona. Sumamente importante para nosotros, que nuestros maestros y asistentes y todo el mundo que trabaje con nuestros niños tengan la oportunidad. Eso para nosotros es importante. El nuevo gobernador ha puesto eso como una prioridad con las nuevas vacunas que van a ser accesibles para esta comunidad. Nosotros se lo agradecemos, le agradecemos el apoyo, le agradecemos que nuestros niños sean parte de la prioridad que tiene el nuevo gobernador, porque nosotros vamos y le hemos prometido que vamos a tener el mejor sistema de educación en la nación. Y con nuestra nueva colaboración con el gobernador, estamos seguros de poder tener y llegar a esas metas todos juntos. Muchas gracias.
Good afternoon. Governor McKee, thank you very much for the opportunity to address this group. Congratulations, sir, on becoming our governor officially. Glad to be up here with my colleagues. We're pleased to be able to offer more flexibility to the businesses of this state as our public health conditions continue to improve. These changes are incremental, but for the businesses involved are very important. So I'm going to express the different changes now. We're very grateful to Governor McKee for continuing to advocate for these changes and helping us execute these changes. It's really been a pleasure. And I want to thank Dr. Alexander-Scott for her continuing partnership to get this done and get it done in a way that keeps Rhode Islanders safe. So thank you. So I'm going to describe 4 areas of revision to our restrictions for businesses today. First, in the area of gyms and fitness centers, Governor McKee and we have gotten a lot of feedback that the constraints continue to be very significant as to their impact upon fitness businesses. We've heard from individual proprietors, and it's a challenging set of conditions. So we are changing capacity limits from 1 person per 125 square feet to 1 person to 100 square feet. We've increased the density that's permitted in a fitness establishment as a result of this. What I want to point out to you is we've talked to individual businesses, gyms and fitness centers, yoga studios, etc. This can mean a couple of new customers for the smallest of studios. It could mean dozens of new customers in a larger or big box facility, and it's very important that even these incremental changes be implemented to help these businesses. I want to remind small fitness centers and studios that we have established an exceptions process for them where they can go still further as to relaxing these restrictions on capacity. They can do so by contacting the Department of Business Regulation. They will need to describe ventilation or testing or plexiglass installation that will help to improve public health conditions in their facility and ensure that their clients are safe. But please contact dbr.ri.gov. Check out the website for the department at dbr.ri.gov and the request form if you are a small gym or fitness center and want to seek more relief. An additional announcement in this first category: outdoor fitness activities conducted by fitness centers, by gyms and professional fitness centers have no capacity limits so long as 6-foot social distancing and mask wearing are adhered to. In other words, a fitness center holding outdoor fitness instruction classes or activities, there's no capacity limit. Second category for today is restaurants. Today, thanks to Governor McKee, we are pleased to announce that beginning tomorrow, we will be increasing capacity limits from 50% of seated capacity to 66% of seated capacity, which was the condition prior to the pause. Restaurants are up to 66% of capacity. Restrictions related to table spacing and number of households per party will still be in effect. We're very grateful to the Rhode Island Hospitality Association and to other associations in our state, including the Ocean State Coalition and the Small Business Coalition, for their advocacy and partnership. Catered events. These are professionally catered events that are conducted in venues across our state, including, of course, weddings, This critical industry has been advocating for key points. We have, under Governor McKee, already offered some flexibility to this industry in recent weeks. We have looked to other states, and there's a fine-grained point here that we want to make, but it's important to the industry, and that's that we will be issuing new guidance regarding dancing at formal events. We know that's important to the industry in order to remain competitive. We want to also point out that starting at the beginning of April, we still anticipate that we'll be able to grow the numbers at such events to 100 indoors and 150 outdoors, and we will have more to say about that as we approach March 14th, daylight savings time, as the governor points out. We'll have more to say about what can be done around catered events and whether we can have a going forward plan that will anticipate still further growth as to capacity in that industry. Fourth, and most importantly, I want to speak of funeral homes. It's been enormously painful for us all to have any restrictions upon funeral homes. The restrictions upon them have been severe, and we're pleased to offer some incremental relief today. The current limits for attendees at funerals or funeral homes is 15 indoors and 25 outdoors, and the restrictions will be lifted to 30 and 50, meaning 30 persons indoors and 50 persons outdoors. That is our set of changes for today. We're very grateful again to Governor McKee for continuing to advocate and to find specific ways that we can advance this process. With that, I believe I'm going to turn it back over to the assembled for questions.
So what is the end goal? At what point is the Department of Health going to say we're at X percentage for infection rate that we can begin to see whatever normal is to get back? What are you looking at over the next weeks and months for metrics to say, okay, now things are going to be at the right number?
Yeah, the high-level view is understanding that the variant taking effect would have increased predominance and could potentially cause spikes in cases and subsequently hospitalizations. We continue to monitor for the hospitalizations mark because making sure that our healthcare system is able to maintain the capacity needed is key. We want to ensure that what we currently have will be able to account for what is potential with the variant. We really hope that with what we have in place now in terms of restrictions, continuing to tread cautiously and giving time for our accelerated vaccination rate to continue, that we would not have to go significantly longer with the type of restrictions in place. We want to make it so that when we do start the reopening process, there is little chance we would have to turn back. So we need to understand where the variant is. We're monitoring with genomic surveillance. We're monitoring with our outbreak numbers, getting a sense of the predominance, and also giving time for getting enough vaccinations out so that our models will show our healthcare capacity is continuing to, would be able to withstand what would occur.
Just one follow with the low spread in schools, the vaccination with teachers. At what point do you anticipate the kids are going to be able to ditch the masks?
There's still time for that. We know the masks are a very necessary and effective tool in decreasing spread. But certainly as we go through our summertime and begin plans for the fall, we will likely have across the board a number of reassessments about where we are with herd immunity and what changes in our society we can achieve together to be able to go forward through the rest of the year once enough individuals are vaccinated and we have control over the variants that are in place. So it's not off the table, but for right now, we want to make sure that masking continues because it is very effective, but we'll certainly be exploring what's possible come fall.
Just to be clear, you mentioned the schedule of the next eligibility group, 60 to 64-year-olds and those 16 and over with underlying conditions is still on track for the middle of the month. Is that correct?
Yes.
You think you'll be able to do teachers at the same time?
Yes, that's...
Allows you to do that when that wasn't the plan before?
Yeah, there are a combination of items that are there. We've certainly proven in terms of our ability to increase the administration. As I shared before, we shrunk our overall timing as we are shifting from phase 1 to phase 2. We have fewer partners that we need to distribute to. That allows our inventory to shrink and for us to get more vaccines out into the community. We also have been working very closely with the pharmacy partnership, where the federal government had required us to allocate a significant number of our vaccines to. And as they are administering, we are being very aggressive with pulling back whatever has not been administered so that we can have that additional pool. And then lastly, with Biden's announcement, we're working continually at a national level to ensure that they are continuing to push additional vaccines out to us so that we can all accomplish this effectively.
You don't expect the sign-up system to get swamped when that happens. I know in Massachusetts they're already booked a week out and they're supposed to start teachers next week. Are you seeing availability right now? Is there some room in the system?
Well, we'll be working with the governor, obviously, and the partners who are out there, as well as with Commissioner, to determine the best plan so that we roll this out in a way that will be effective, allows for our state-run and larger mass volume sites to continue with the focus on the eligibility groups that are there, while also ensuring that our educators begin a vaccination process that might be a little bit more refined for what they need.
Just on the homebound, I know you mentioned the Johnson & Johnson. There's still a lot of concern. I know that you've mentioned the sign-up list for people who want the vaccine who are homebound, but what is the plan to actually get it to them? We're still hearing a lot of concern that they're not actually getting the vaccine.
Yeah, that has been an important community for us to focus on. We have been working with vendors who are going to be able to reach out to the individuals and access them directly who are homebound. So having that list has been important to build to make sure that we are capturing those who we don't already have information on. We've appreciated the work that our municipalities have done with helping to engage, and we'll be pulling in those additional vendors who can actually go to the homes and ensure that. That's also a focus for this month.
Education Commissioner Infante-Green. In Massachusetts, Governor Baker has said April 1st he wants the children back in school. Cranston today announced school committee that soon K through 12 have the K through 8, I believe, have the option of in-person. Where do you stand with what is it going to take, or what is the deadline to get children back in the classroom?
Well, we want the kids back in the classroom tomorrow.
But it's not going to happen tomorrow.
Right. So one of the things that we're doing is working very closely with the superintendents as well as with the municipalities to see where we're going to go very quickly in the next 2 or 3 weeks to get teachers vaccinated and make sure that we have a very steady plan. As you know, we've been planning step by step alongside the superintendents. So I think that we will see where we are. Part of our limitations, to be totally honest, is the CDC guidance in terms of busing, in terms of how many kids can be in the classroom. We hear that that's going to change. So that becomes a little more difficult for certain districts that don't have the space.
So you don't want to give a deadline of April 1st the way Massachusetts is?
Well, I don't think we can do that right now.
They're doing it.
Well,
they're the #1 school system in the country.
Well, they have handled the pandemic a little differently. So I would say that we've done a better job with the schooling than Massachusetts has. So.
Even though they're going to be back in.
So let me clarify something. We have 208 schools in person, fully in person. So let's get the numbers That's more in proportion than Massachusetts. We have 99 of them hybrid, which means that they're sharing the space because they don't have the space. We only have 4 schools that are virtual, 4 that are fully virtual. So I think it's really important for us to understand where we are. We have the majority of our kids are in person. So I think that we will continue to work because what we want is all the kids in person all the time. So we're going to continue to do that. They can put that deadline, but remember, they have not been in school all year. They have not in Massachusetts.
In just regards to the Providence contract, if this were a 9-inning baseball game, in your mind, where are we in that game? Because it's coming up on 2 years, where there was the Wall Street Journal Education Horror Show Nightmare. At the end of last year, you said, if we don't see action, I'm going to take drastic action. Where are we with that contract?
We're in the 9th inning. We're in the 9th inning, yeah, and we've been negotiating for over like 300 hours. So we're at the tail end of that.
Bill, your question?
Doctor, what's the impact of the vaccine on the serology test? And then is there a number you're looking for in that serology test that may impact business reopening decisions?
Yeah, it'll be helpful to see what we learn from that, knowing how far we have come since the first iteration of the serology testing. We've been working and very much appreciating our testing and validation task force experts who have continued to keep us abreast of what's out there in terms of the serology testing capabilities and how it can inform our policy making. Right now, it's still too early to tell whether or not there would be any dramatic shifts, but similar to before, we'll hopefully be one of few states that will actually have this data to help us understand, is there something differently we can do with vaccinations? Will it help inform how we can support businesses as we go forward? We're looking forward to seeing what information we gain.
The last go around sort of showed that everybody who said, hey, I had COVID or I think I had COVID in the wintertime probably didn't. Is there any reason to think that that may have changed, where we've had a lot of asymptomatic people not tested that probably had the viruses, or anything indicating that going in?
Yes, it's very possible. And true to how this pandemic has been educational overall, it will be interesting to see what we gain, knowing the increase in asymptomatic prevalence that has occurred and knowing the variant that's in place now.
Question in the front, and then Alexa after that. Secretary Pryor, you mentioned restaurants, the changes are tomorrow. The other 3 groups you didn't give a timeline for. Could you fill us in?
Yes, all of the changes are effective tomorrow, with the exception of the catered event changes that I referred to. It's our expectation that we'll be able to grow to 100 indoors, 150 outdoors, and that will be able to include those changes to dancing rules as pertains to safe conditions for such activity. That still needs to be formalized and put forward in the way of guidance. We likely will be able to do that by mid-month, the governor's demarcation point of March 14th, and we're in dialogue with those industry groups. But the other changes are in effect tomorrow. I also note, while I'm on the subject, if I may, I realize on the issue of fitness and gym establishments, Governor McKee and we have received inquiries from martial arts studios and other fitness establishments that involve contact between participants. We are creating a set of rules by which those activities may resume, and we'll have more to say about that in detail for those that are interested.
Alexa, and then Pat after that.
Secretary Pryor, the curfew on bars is still hurting a lot of restaurants. They have to reserve tables for their bar seats so that they can move over once 11 happens. When are we going to get rid of this curfew? Why do we still have it?
The question was about bars. Thank you for asking it. We have not yet revisited those rules. I will note that our neighboring states still have rules that keep bars closed. So in Massachusetts and Connecticut, you will not find bars open. We've created rules in close consultation with the Department of Health that enable, although restricted activity, bars to be opening for seatings. So we're grateful that we are operating at that level. We will continue to revisit all rules under the governor's guidance.
And then just one question for for Dr. Alexander-Scott. I'm hearing reports that people aren't able to fill their prescriptions right away. They're going to retail pharmacies, and these pharmacists are telling them that they don't have time to fill their prescription right now because they're so busy with vaccines and to come back the next day. Are you hearing reports, and how can you mitigate that?
No, I have not heard that as of yet, but appreciate learning of this, and as always, we'll bring that back and help address it as well.
Go Pat, and then Amanda after that.
Commissioner Infante-Green, regarding RICAS, clearly this is a difficult time for standardized testing. Missed classroom time will minimize the availability of teach to the test prep that is typical of most school districts. Logistical issues, timing, physical space, COVID distancing, impediments to testing, and clearly scores will be artificially impacted by the classroom disruptions typical of the COVID era. My question, states like Colorado and Ohio are debating legislation that would suspend standardized testing, simultaneously approaching the federal government for a waiver. The Biden administration has signaled a level of receptiveness to this provided data as long as that provided data is collected about the impact of COVID generically. Is Rhode Island contemplating this, given the real question about the validity of teaching gains or losses based on all of the above?
Sure. So the Biden administration put out a letter, and we applied for the accountability waiver. They have not given a waiver on testing. That is not the case. So a couple of things so that we are clear. The assessment is actually more important now than ever because we do need to know where the kids are. Everybody's talking about learning loss, gaps. We don't know what that is. We actually need to be able to measure that and measure it for each student. And it allows us to continue to advocate for the needs of our kids. We've been conducting our advanced accreditation and advanced placement for our students task force, and we call it LEAP, which is Learning Equity Advancement Pathway, which the governor helped launch, where we're looking at individual students. Where are we going to focus? Where are we going to move forward? And we need the data to do that. We're pretty clear on that. Everyone that we have brought into our sessions, which are open to YouTube for everyone to participate, has made it very clear that the data is going to drive where the needs are. I know that with our preliminary data that we saw, so one of the things we did with our stimulus money was get interim assessments. The places that we have seen the biggest impact is in the earlier grades, which stands to reason if you think about kids learning to read and all the things that need to happen. So we need to focus our energy, but what we're not going to have is the accountability piece. The piece where we say, oh, you need to improve in this area. No, we're looking at the kids, what we need, and where we should be focusing our attention and our resources. So two very different things. With the accountability off the table, we all know that COVID has had an impact on all of us. We know that. We just need to know how much. Is it a 2-year gap? Is it a 3-year gap? What is it? So.
And then Anita after that.
My question is on restaurants. So for either of you, restaurant owners are really hoping to have that 100% capacity soon. Do you have sort of a timeline on when you can ease restrictions on restaurants? They're really wanting 100% capacity with 6 feet of distancing. I guess what made you choose 66% as a number?
Our focus is to take incremental steps as we go. We certainly wanted to, in support of the governor, show that there could be some steps that we continue to take carefully. We want to also have the time to assess what's happening with the variant. As more cases have been identified, we've started to see an increase in cases, really get an understanding of what direction that is going in. And then also take the time over the next few days to be able to put together a full package that we can present to businesses that allow for an incremental overall long-term reopening that people are familiar with up front. That's going to be new about how we present it going forward. So we want to take the time we need to really prepare that and bring it back.
Last question from Anita.
Can I just follow up? With a question on vaccinations, when people are going to these state sites, they're wondering, can they choose what vaccine they get? Will people be able to do that, or sort of they get what they get?
No, the goal will be that the information will be available, so they'll be informed about which vaccines are available, knowing that we now have 3 very effective vaccines for achieving the goal we've had in place, keeping people out of the hospital and keeping people alive.
I have two questions. Secretary Pryor, you spoke about catered events and the restrictions loosening soon. One of the restrictions is requiring that guests get a negative test prior to the event, which is a big ask, and I'm hearing that that's very troublesome for those. Are there plans to increase it? I think it's 15 now, or eliminate that once the vaccine is more widespread?
We're in dialogue about all of the conditions that we've instituted to enable safe reopening. I'll say this, though. New York has likewise instituted a testing requirement for their catered events. So it's a trend in our region. I'll also say that the ability to reopen with confidence relies upon having certain safety precautions in place. And if you think about a catered event, an event like a wedding where many of the people at the event are very familiar with each other, they are in fact family, they are close friends, almost by definition, those are really social gatherings in a formal setting. And those are places where infection can occur if we're not careful together, which is why we've worked very, very closely with industry groups to establish the precautions that will enable us to reopen with a degree of acceleration here, but not to be one of the places on the planet where we see outbreaks. So having said all of that, we will continue to evaluate all the preconditions, including testing, as we go forward.
Governor, you spoke about vaccine hesitancy yesterday, your executive order. The church has come out and said that there are moral concerns about the Johnson & Johnson vaccine. I don't know where Rhode Island stands, we haven't heard back yet as far as our bishop, but are you concerned that it's going to push people away from using that vaccine? There's already people who are telling us they don't want the Johnson & Johnson vaccine because of its effectiveness. Are you worried about this?
Yeah, so the Johnson & Johnson vaccine saves lives and keeps people out of the hospital. That is an absolute, and that's what people need to know. So if they're looking to save their lives and get out and not go in the hospital, they should be taking the vaccine.
Are you worried about vaccine hesitancy, though, now that
Oh,
the church
yeah,
has...
we are definitely concerned about that, and that's where we spent yesterday visiting churches, visiting businesses, visiting sites, and I see this as an all-in, right? It's an all-in. We need to have all our municipal leaders, civic leaders, church leaders, along with our state leaders, Department of Health. This is an all-in, because I've been saying this for weeks. There's going to be a point in time when we have more vaccine than we have people willing to take the shots. We got to get 70 to 75% of the people vaccinated in the state of Rhode Island to make sure that we're reopening in a way for our schools and our businesses. So it saves lives and it keeps people out of the hospital. That's the most important message that people need to hear.
Are you talking to the diocese at all?
Please?
Are you talking to the diocese about this?
We'll talk to anybody that can be helpful to us. And I'm not sure exactly what you're talking about there, but we'll definitely follow up because it saves lives and it keeps people out of the hospital. It's proven to be that case. So anybody who's like pushing back because it is not effective, they really are not working on the science that we know is true to be true.
Back on its development and not its effectiveness, the way that it was developed on potentially aborted fetuses. NPR did a whole piece on it yesterday.
People can make up their minds in terms of where they are religiously. It saves lives and it keeps people on the hospital. That's our job to make sure that happens.
Governor, a couple of questions about small business that you had a big focus on as Lieutenant Governor. Is there any money left from the original tranche of money? And going forward, what's your vision? You've got big stimulus coming in. I'm wondering what you're thinking. The businesses have been waiting for you to become governor. What's your message to them now?
Yeah, so we're going to put out several millions of dollars in grants that were carryovers. That'll be announced when we announce the budget, which is coming up very quickly. And we're going to continue to create incremental, advancement in terms of our business footprints as we have today. But the goal is to beat this variant down over the next couple of weeks. It's very important that we follow the protocols to the nth degree so that when we actually enter in the back half of March, we're starting to open up our businesses. And then the other piece there, get the PPP loans, right? And then we're going to be working on regulation to make sure that Rhode Island continues to improve as a small business friendly state. Thank you.